Does hip joint deterioration always requiring surgery for treatment? When we talk about hip joint deterioration, many people wonder if surgery is the only option. The truth is, surgery is not always necessary. Hip joint deterioration is often linked to conditions like osteoarthritis. The treatment approach really depends on how severe the condition is, along with factors like the patient's age, activity level, overall health, and how well they respond to non-surgical treatments. At first, doctors usually recommend non-surgical treatments to help manage symptoms and improve joint function. These treatments can include physical therapy and stretching programs. These aim to strengthen the muscles around the hip and enhance mobility. Anti-inflammatory medications and pain relievers can also be effective in reducing pain and inflammation. Additionally, rest and modifying activities to avoid movements that worsen the condition can be beneficial. In some cases, injections into the bursa, which may contain corticosteroids and local anesthetics, can help reduce inflammation and relieving pain, especially for conditions like trochanteric bursitis. For many individuals with hip osteoarthritis, these conservative measures can effectively manage symptoms and may even delay the need for surgery. However, if the deterioration progresses to a point where there is severe pain, significant loss of function, and a reduced quality of life, then surgical options might be considered. The most common surgical procedure for this issue is hip replacement surgery. This can be either partial or total, where damaged bone and cartilage are replaced with artificial components to restore function and relieving pain. Surgery is generally recommended when non-surgical treatments do not provide enough relief. If there is severe joint damage, significant cartilage loss, or if daily activities are heavily impacted, surgery may be the best option. In younger patients, doctors may try to preserve the natural hip joint through other procedures, especially if the damage is due to fractures or less severe deterioration. Emerging treatments in regenerative medicine, like stem cell therapy and platelet-rich plasma, are also being explored. These treatments aim to slow down cartilage deterioration and manage symptoms in the early stages of osteoarthritis. However, they are usually considered supplementary to standard care rather than replacements for surgery when it's clearly needed. In conclusion, hip joint deterioration does not always require surgery. Many patients find relief through conservative management and non-surgical interventions, especially in the early to moderate stages. Surgery is typically reserved for advanced cases. It's crucial for individuals to discuss their specific condition with orthopedic specialists who can guide them toward the most appropriate treatment plan.